So, good evening, sir. Very happy to once again have a chat with you. Today, now we've talked a lot about epilepsy in different ways, and this being National Epilepsy Month, I was hoping we could talk about something that is not discussed very commonly, which is epilepsy beyond the seizures. So, I'm really glad to have you. We'll start, sir.
Thank you for having me. Let us introduce to the audience that this month is National Epilepsy Awareness Month. In fact, in every year, we have an International Epilepsy Month and National Epilepsy Month. There are so many days which focus on such conditions in children, but this month is very special for us because we want to bring exclusive attention of all the stakeholders who are involved, especially the families, the parents, school teachers, and now we have plans to start NGOs who are willing to work on epilepsy. So we want to bring everybody to the platform and focus on pediatric epilepsy.
It's very interesting, sir. Now, the first question I have for you is since I discussed the topic, which is going to be what is epilepsy beyond the seizures, could you tell me a little bit about that? Because I think when I think of epilepsy, I only think seizures. So,
Exactly.
Yeah.
So that's the exact reason
Yeah.
I wanted us to have a discussion on this topic. Because when it comes to epilepsy, everyone, including a parent or a teacher, everybody will ask, will my child get another seizure? Yes or no? How do I prevent a seizure? Okay, so seizure is one of the most important and the most common manifestation of the condition called as epilepsy. But epilepsy is a disorder of brain. Like any other disorder of brain, epilepsy also affects several aspects of brain. Brain is one organ where you cannot separate the individual parts of the brain and say it only exclusively deals with a certain function. Any dysfunction of brain can lead to a myriad of symptoms. For example, let me give an example. In adults, there is a common condition called Parkinsonism. The prominent symptom of Parkinsonism is tremor. You might have seen even a commoner old man with tremor. But they have several other symptoms which are intricately linked to the disorder. Similarly, epilepsy has almost, I can say, 6 or 7 common problems which are often overlooked. Yes, the most important being cognition. Next, mood, sleep, emotional regulation, sometimes even psychiatric comorbidities, and overall general well-being.
That's very interesting. That's many symptoms. So, what exactly do these symptoms how do they affect you? In when it comes to, for example, cognition, how does cognition really affect somebody? Could you give an example?
Yeah. So for a child, they are going through schooling, right? And they have to learn a lot of activities and new things every day. So cognitive process is very important for their childhood development. So for example, a normal brain or optimal brain function is required for good cognitive development. Any disturbance, here it is the seizure, and not only the seizure, even without the seizure, the brain is constantly undergoing abnormal electrical activity. Both of this, along with other comorbidities, like we mentioned sleep disturbance, can intricately affect the cognition.
Okay, understood. So a child with epilepsy, now since you said it affects cognition, does this also affect your memory, your focus, and how does it work short term and long term?
Yes. So let us now go into depth of epilepsy. There are several forms of epilepsy, just for a parent to understand in more depth. So this part of the brain, which is the largest part, is called frontal lobe. And the ones on the sides, it's called temporal lobe. This part is called parietal, and the one on the back side is called occipital. Let us leave this parietal and occipital, which is not very common for these kind of processes. Frontal lobe and temporal lobe are very, very important for human intelligence, cognition, memory, emotions. Frontal lobe is required for your planning, execution, judgment, social inhibition. Social inhibition means a child should be quiet, calm in a social environment instead of throwing up tantrums. Like that's called social inhibition. If any disturbance in the frontal lobe can lead to a complete dysregulation of any of this. Similarly, temporal lobe has an important structure which is called as hippocampus. Hippocampus is a seat of memory. Any disturbance or dysregulation of temporal lobe can affect memory. Yes. So these disturbances are the one which causes epilepsy or seizures, which indirectly cause disturbance in any of this function. This I am just explaining for the parent to understand how does epilepsy affect these faculties of the brain.
Yes, of course. So you also mentioned that it's responsible for your emotions and emotion regulation. So a child with epilepsy might also be going through maybe anxiety, depression. How will a parent help in this case, and how can the child be helped?
Yeah, that is very, very important question. So often we think like these symptoms are part of normal childhood, being anxious, being even irritable. Sometimes parents think that's like a normal kind of a thing. It's very, very important for the parent to understand these comorbidity symptoms can be present in epilepsy. They should watch out for these symptoms. They can look for these symptoms. If the child has any of these symptoms, they should empathize with the child and they should bring it forward to the attention of the doctor. And early support can make a big difference. So it is always good to watch for those symptoms and report to us.
Absolutely. I think that's a very important message for parents to have. And speaking of important messages, do you think that there is still a lot of stigma attached to epilepsy? And especially, I'm sure this can affect a child's confidence and their overall outlook on life, right? So,
Yes, that is something very important. Like, let us delve into depth of that. So, stigma is part of most of the common label. Like, you get a label of any disorder, stigma is automatically attached to it. Particularly so with epilepsy, because people think epilepsy means it's a lifelong condition. They have to take medicine for lifelong. It's incurable. They can't lead normal life. Often they get overprotected, saying that they can't do any physical activity. They can't do homework. They can't they can't do any focused activity. So this kind of stigma can affect a self-esteem of the child. Maybe even it can even lead to social isolation, and can deprive the child of his or her normal childhood. So creating awareness among the parents and the peers and the families that children with epilepsy feel accepted, let them feel like a normal child instead of overprotection or any form of stigmatization. I think it's very, very important to have a free discussion. Even the family members and the teachers and even some of the close friends of the child, suppose they come to know about the diagnosis.
yes, I think that's a very important message, because stigma is something that, like you said, with any kind of disorder, it's something that you have to carry with you. So it's absolutely important that parents treat it as such. Another question I had, you mentioned medication and lifelong they would have to be on medication. Does that also have side effects? Will it affect your mood and your thinking?
Yes. When we start a medication, the immediate reaction of the parent is, even before they understand what are the benefits of the medicine versus the risks, they would immediately ask, are there any side effects? So let me spend some time here. So when, according to the Hippocratic oath which we take, do not do harm even if you cannot do good for the child. That's the first principle which we follow. So when we start a medication, we have actually thought in our mind, does the child really require a medication to prevent seizures? That's a vigorous process which goes through in our mind.
Absolutely.
At the end of that process, we decide, yes, this child needs medication, and the benefits which the child get by taking this medication on a long-term basis far outweigh the risks involved. Only then we start prescribing a medication. There's a small correction here. Often people think epilepsy means lifelong medications. No. Majority of epilepsy tend to resolve over a period of time.
Is that so?
Yes, exactly. Even up to 60% of epilepsies can resolve on their own. By resolution, I mean naturally getting cured.
Oh.
That is because brain has some inherent tendency to correct any abnormality. Like we talked about neuroplasticity in the past. Until that natural resolution happens, children with epilepsy who have tendency to have recurrent seizure should be taking a medication to prevent the seizure. So when we choose a medication based on several parameters. Number one being safety and tolerability. Yes, These medications which are available in the market for epilepsy are time tested, well tolerated medications. They come after a rigorous process of scientific testing. And often we monitor the children also, watch for any potential side effects. So by and large, the parents don't have to fear side effects. If they notice any side effect, they can always report to the doctor. And I won't say there is no medicine in the world without side effect, but we start low and go slow as we do with any other neurological condition.
Absolutely. I think that's. I actually have a question for you over here. You talked about how 60% of it does get resolved, but I'm sure on the off chance 40%, when a child is, let's say, they're growing up and they will have to go through a transition, right? So how can the parent and how can a doctor support the child through this process of them aging?
Yes, that's a very interesting question. As you said, 40% may not resolve. For example, there is a specific condition called juvenile myoclonic epilepsy. We call it JME. The treatment is lifelong. Yes. We diagnose them probably around 11, 12, 13 years of age. They become adults and then they can grow into adults and they can live normal life as an adult if they follow the advice which we give them. So they are often well controlled. So around 17, say 18 years of age, we plan something called transitional care. A good pediatric neurologist should try to transition the patient to an adult neurologist and adult epileptologist who will be able to take the best care of the patient. So this should be communicated to the patient and the family probably 1 year in advance, so that they, in their mind, they are already prepared. Yes, we are going to move away from this doctor's care and also to another doctor. And for the initial period of time, there can be a hybrid mode. Like they are seeing the previous doctor whom they have been seeing for many years, as well as the new doctor, until that they are comfortable with the new transitional care as an adult, and then move on. And we always have a prepared plan, and always we keep in touch with the families. So this transitional care model is not yet fully developed in our country. In Western systems of medicine, they have very beautifully functioning transitional care. I think we should build upon that.
Yeah, absolutely. So I think it would be a great initiative to take upon. Okay, so I actually wanted to ask about this. We've talked a lot about the medication aspect of it. Now let's talk about the therapy and counseling and the other aspects to help epilepsy beyond the seizures. How exactly does it help with their emotional and cognitive outlook on life?
So let me go problem by problem. The most common problem which every parent comes and tell us is learning difficulty. So children with epilepsy, they often come and tell us child has difficulty in learning, he's performing poor, he has difficulty in reading, writing, mathematics, he's not able to hold on to the subject, like his memory is weak, he's weak at school. These are different terminologies which parents use. So the first thing which we do is, number one, is the epilepsy well controlled? Number two, have we addressed the underlying neurological cause? Like often they may have a cause which is correctable. To give an example, an infection of the brain, like suppose it causes some form of epilepsy, that has to be tackled, or an autoimmune process. Number three, is the patient on the right medication, right dose, right choice? Because making the right dose, right choice and optimization of the existing treatment can go a long way. Sometimes you may be on a higher dose which is affecting this performance. So keep the child on the minimum possible dose. Even after these parameters are taken care, if there is a significant learning difficulty, we should get a detailed learning assessment. In our country, learning assessment is not happening because our parents think poor learning is common, or like we call them as like an underperformer or a slow learner. No, they need to undergo an SLD screen. SLD stand for specific learning disability. We have a battery of tests which is usually done by our psychologist, which can identify a child with specific learning disability. If that is the case, then the child needs to be put on one-to-one special education with remedial educational support, because there is no other way where you can help the child and improve the performance.
Absolutely.
So this is learning. Now let us come to the behavior. They can have significant behavioral issues starting from low mood like being a withdrawn child, a child with a shy behavior, to somebody who is ADHD, autistic, hyperactive, aggressive. All kind of behavioral problems are possible in children with epilepsy. So we need to again go through this rigorous process which I told you. Correct diagnosis, correct medication, correct choice, is he taking appropriately? Then we should refer the child to our child psychologist for a detailed assessment. The tool which we do for that kind of an assessment is called CBCL, Childhood Behavioral Checklist, which actually has 7 categories of, like, it will have categories like hyperactivity, inattention, anxiety, disruptive behavior, aggressive behavior. It can find out in which category of behavioral domain the child is having significant issues. And then, of course, last time we discussed parental strategies, lifestyle modifications, structural routines. Sometimes they may require behavioral therapy. If the problem is significant, yes, behavioral therapy can definitely improve their behavior. Rarely we put them on medications. For aggressive behavior, we try a medication called risperidone or aripiprazole. These are FDA approved and even DGC approved medications. Sometimes they have like a withdrawn behavior which improves with a behavioral therapy or even a supportive counseling. So what I'm trying to say is, these problems are often overlooked without being evaluated. When the patient comes for follow-up, many doctors will simply ask, is he seizure free? Yes. Continue same. No. We need to go beyond seizures and ask these questions even if the parent is not bringing it out.
Okay, got it. So do these challenges change as they grow older? How does it affect their classroom or their like peer group? Apart from like learning, how does it affect in other ways?
Yes, they can definitely go through changes, particularly around the time of puberty. Because of hormonal changes, seizure control can also fluctuate. A child who has been well controlled for years may have seizures around the time of puberty because of hormonal changes. Next is a change in an environmental factor. Like you said, somebody who is well controlled, taking medication, doing good, goes to a new school, starts exhibiting some new issues because he has to adapt to a new environment, or an adjustment reaction. For example, a family member, like a father, went out of the family or a family got separated. So these kind of problems can create a lot of issues. So I think when we try to analyze all these symptoms, we have to see the child from all angles. And involving the school health authorities and the school teacher is very, very important. So once in a while, we ask a note from the school, how is the child performing? Do they face any issues? Sometimes we ask the parent to go to and talk to the teacher and explain. By the way, every parent of a child with epilepsy should report to the school that the child has epilepsy, and epilepsy can have several other factors, and this is not a part of the child's performance. This is a natural condition which the child has.
Occurrence.
So the teacher also starts empathizing with the child instead of starting to scold the child or admonish the child.
That's a very important message, Doctor. Now, you talked about looking at the child from a whole perspective. Can we talk about how lifestyle like diet and your sleep can affect a child with epilepsy?
Yes, it's very important. There are multiple reasons can affect their nutrition. Starting from the condition itself, sometimes a child with epilepsy can feel tired, so that they start gaining weight because of sedentary lifestyle. The medications, like there is a medication called sodium valproate, which is one of the very commonly used medication that can actually cause weight gain. There is a medication called topiramate, which can cause weight loss. So their nutrition can go haywire. So it is very important to maintain their nutrition, adequate balanced diet, and checking their weight, height, and keeping that in an optimal range is very important. Number 1. Number 2 is physical activity. A child with epilepsy can become sedentary because of the medications or because of overprotection that the parent might say that don't go out for any physical activity, or they could be even hyperactive because of their underlying ADHD comorbidity. So it's important to have a regular physical activity. The third thing is hydration. Very important to maintain 2 to 3 liters of water. If it is a bigger child, even 3 liters is good enough. Good hydration can keep them active. Sleep and stress management. Sleep is absolutely essential for any child. We all discussed that multiple times, particularly with respect to epilepsy. Because one of the most common trigger for a seizure is lack of sleep. In fact, I used to tell the parents, we used to see so many parents who outstation patients coming from other states. They would have been fine. On the morning they landed with us, they had a seizure because they traveled overnight and the child didn't sleep and had a seizure in the morning.
Oh my God, okay.
Better avoid travel in the night if you are having epilepsy. If at all you are planning some long tours or trips, try to take in a daytime and avoid disturbance of your sleep. Stress management is very, very important. Keeping the mind calm, relaxed is like one of the important contributor to epilepsy management. Like you can do simple meditation, simple yoga, or a mindful activity. Children can involve themselves in some simple productive activities, like even like cooking or helping the parents in cutting vegetables. So these kind of activities can be so relaxing and helpful for them. And the last part is screen time. As usual, every discussion of our doesn't stop.
Yes,
Yeah.
it always has screen time as a
So
concept.
except for photosensitive epilepsy, exposure to screen directly does not lead to epilepsy or seizure, but excessive screen time is detrimental to brain health, like with any other neurological condition. So limit screen exposure.
I think these have all been very, very useful tips. Thank you so much for this, for me being able to pick your brain on this. Would you like to share maybe a message, take home message for all the parents out there who are watching this?
So from this whole conversation, what I'm trying to convey or what we are trying to convey is epilepsy is not just about preventing the seizure. It's about nurturing the child as a whole from a holistic management perspective. We need to understand these problems. We need to screen for these problems. If these problems are present, we need to effectively manage the problem so that the child can learn well, become a protective citizen, and they can lead their future life without any limitation. So if your child has any of these issues, bring it out. We will be able to support you and help you.
I think that's a beautiful, beautiful take home message. Thank you so much for having this conversation with me, and I hope that parents out there have really been benefited.
Thank you.
You so much.